Welcome to Medicoria. In today's video, I bring you more than 23 causes of coronary artery disease. Coronary artery disease is also known as coronary heart disease, CHD, or ischemic heart disease, IHD. It is a collection of diseases or lesions in one or more of the coronary arteries, usually the epicardio-coronary arteries, that results in impaired cardiac perfusion. If the phrase epicardio-coronary artery seems rather confusing to you, I recommend that you watch my previous video on Angina Pectoris, in which I bring out clearly what epicardio-coronary arteries are. I have provided a link to this video in the description box of this current video. Usually, coronary artery disease is asymptomatic in its early stages, and symptoms only show up when over 50% of the coronary blood flow is lost. For simplicity, I am going to group together related causes of coronary artery disease to make your understanding easier. Number 1. Atherosclerosis. Atherosclerosis is the thickening and hardening of arteries resulting from subendothelial deposition of oxidized lipids, particularly the low-density lipoproteins, in the arterial wall, leading to inflammation, necrosis, and fibrosis. I'll be bringing you details pertaining atherosclerosis in a separate video. To make sure that you do not miss out, do subscribe to the channel and turn on your notifications such that you'll be the first to know when I release this video. Atherosclerosis accounts for the majority of the cases of coronary artery disease. Does this mean that other causes do not happen? Well, not exactly so. Here is an illustration to demonstrate atherosclerosis. In the upper part we can see a normal coronary artery with a wide lumen, whereas beneath it we can see an abnormal coronary artery with some fat deposits beneath its endothelium, narrowing its lumen. Number 2. Arteritis. Arteritis is a collection of diseases that result in inflammation within the walls of an artery, in this case the coronary artery. This inflammation results in narrowing of the lumen of the artery due to swelling of its walls. Arteritis can be a result of autoimmune conditions such as systemic lupus erythematosus, polyarteritis nodosa, rheumatoid arthritis, ankylosing spondylitis, Takayasu disease. So as you manage those joint pains and the cutaneous manifestations of these conditions, do remember to keep the coronary arteries in mind. Arteritis can also be a result of certain infections, for example syphilis in its tertiary stage, tuberculosis, among other infections. Here is an illustration, a light micrograph of a histologic section of an artery with arteritis stained with the H&E stain and viewed under the low magnification of the microscope. Here we can clearly see all the inflammatory infiltrates within the wall of the artery and the narrowing of the lumen resulting from it. Strictly speaking, this image is of a specimen obtained from an artery supplying the brain of an individual with giant cell arteritis, but well, I believe it still serves the purpose of illustration here. Number 3. Embolism. Embolism refers to a phenomenon where material from a distant location gets lodged into an artery. Emboli can come in different forms. One cause of coronary embolism is infective endocarditis, where we have infected vegetations moving all the way from the heart and getting lodged into the coronary arteries, cutting off the blood supply there. Emboli can also be dislodged thrombi or pieces of tumors from the left side of the heart, either the left atrium or the left ventricle, and these find their way into the coronary arteries and block the blood flow there. They can also be dislodged thrombi from prosthetic valves. Materials from the right side of the heart can also find their way into the coronary arteries through what is known as paradoxical embolism. Paradoxical embolism occurs when material moves from the right side of the heart into the left side of the heart through a defect in the septum separating the two sides of the heart. Otherwise, without a defect, emboli from the right side of the heart usually end up in the lungs. Embolism can also be a result of interventions performed in the hospital, for example, catheterization of the heart. Here is an illustration demonstrating embolism. We can clearly see material coming in from a distant side and getting lodged into a narrow portion of this artery. As we talk about embolism, let's not forget about thrombosis in situ. Thrombi can also form from within the coronary arteries rather than travel from a distant site. This is usually a result of a ruptured atherosclerotic plaque. Now let's look at coronary mural thickening, which simply means thickening of the walls of the coronary artery, resulting in narrowing of the lumen of the artery. This can be caused by amyloidosis. Amyloidosis is the deposition of misfolded proteins in the different tissues of the body, in this case the coronary arteries. Ehlers disease is similar to amyloidosis, only that this time around we are depositing mucopolysaccharides, call them glycosaminoglycans, instead of protein. In Psedoxanthoma elasticum, there is deposition of calcium and other minerals in the elastic tissues of the body, including walls of arteries like the coronary artery. Radiation therapy is also known to cause thickening of the coronary artery if the heart happens to fall within the field of the radiation. This happens because radiation therapy causes deposition of fibrous tissue within the walls of the coronary artery. In this illustration, I would like to draw your attention back to Psedoxanthoma elasticum. This condition presents with rather benign skin lesions, and these tend to happen earlier in the course of the disease. The lesions typically appear in the posterolateral aspect of the neck where they have a cobblestone appearance. They can also appear in the axilla where they cause abnormal folding of the skin of the axilla. Lesions of Psedoxanthoma elasticum can also be papules. These papules have a yellow appearance if they occur in the skin of a white person. However, the yellow color is harder to see in the skin of a black person like me. In other words, these lesions look more or less like the xanthomata of hyperlipidemia. And these lesions can be confused with atherosclerotic coronary artery disease because even in the atherosclerotic type there is calcification at some stages. Let's conclude with these other causes of coronary artery disease. One cause which I believe should be familiar by now from my previous video on angina pectoris is coronary artery spasm, which results in a type of angina known as prinzmetal angina, also called variant angina or vasospastic angina. Coronary artery disease can also be a result of coronary dissection, which is simply a slit through the wall of the coronary artery. Coronary artery disease can also be a result of coronary artery anomalies. Coronary artery anomalies are a big topic on their own, but they include things like arteriovenous fistulas, anomalous origin of the coronary artery from the pulmonary artery instead of originating from the aorta, osteoarthritis, coronary arteries causing in the subendocardium rather than the normal epicardial cause, abnormalities of termination of the coronary arteries, among other coronary artery anomalies. So, it appears we finally come to the end of this video. I hope by now you can list down over 25 or even more causes of coronary artery disease. If you enjoyed this video, don't forget to like, to comment, to subscribe, to share, turn on your notifications. Also feel free to leave behind a donation via the means outlined in the description box of this video. Thank you for watching and see you next time.